Well, if you're like most people, this winter has been dragging a little bit, right? Kind of tired of this cold weather.
A little, yeah.
A little bit.
All right, but did you know that weather can affect more than your mood? It can also affect your body, specifically vitamin D levels. CBS 2's Dr. Max Gomez is here to tell us why this is so important. Max.
That's right, Dick and Christine. You know, we've known for a while that vitamin D is important for bone health because you need it to absorb calcium. But doctors are now learning that vitamin D may also be important for heart health, your mood, and may even help prevent cancer. Here's some signs you might be vitamin D deficient, especially in the winter. As long, cold, and snowy as it's been this winter, the last thing we want to do is show some skin. But sunlight on skin is how our bodies make vitamin D. And even in the summertime, we're told to always wear sunscreen, which also inhibits vitamin D production. So what does that mean for our vitamin D levels?
About 40% of U.S. Americans are actually considered deficient based on studies that have been done. And it's obviously a bigger problem for more of the northern latitudes where we have less sun exposure.
I get my vitamin D through my diet, although I should take the vitamin D supplements according to my doctor.
But how can you tell if you're low on the sunshine vitamin? The only sure way is with a blood test. But there are a few things to watch out for. First, African Americans and those with darker skin are at risk because sunlight doesn't penetrate through the melanin. Feeling depressed or a little blue, possibly related to seasonal affective disorder from lack of sunlight. And older folks just don't make as much in their skin or convert it to the active form in their kidneys. Low vitamin D has been associated with high blood pressure, but taking vitamin D supplements did not lower blood pressure in a recent study. So some cardiologists have been a little skeptical about it. But they say there's still suggestions that it's good for your heart.
Vitamin D supplementation reduces inflammation, decreases cholesterol uptake by circulating blood cells, and atherosclerosis.
Other signs of low D include being overweight, having achy bones, and suffering from intestinal problems like Crohn's or colitis that might keep you from absorbing the vitamin. Finally, more reasons to take vitamin D.
Higher vitamin D levels may lower your risk of breast cancer, colorectal cancer.
Again, the only way to know for sure if you have low D is with a blood test. But most doctors say 1,000 to 2,000 units of vitamin D a day is a safe range and may actually strengthen your immune system. Dick, Christine?
All right, Dr. Max, thank you. Maybe that explains why I'm in a better mood.
Well, a little more sun, a little less wind, and perhaps springtime really arriving. That might be the solution.
I think so. I think you have the perfect formula.